Hi everyone, Dr. Ortiz here. Thank you so much for coming by. This is an early video, maybe my first. And what I'm hoping to do is just provide a little information, some education to help you understand your body a little better, understand rheumatology a little better, maybe start some conversations between you and family members, you and your doctor. Information never hurt nobody, and the key is having trusted sources. And I can tell you I'm a rheumatologist. I've been a rheumatologist for 10 years, seen lots of patients, had lots of conversations, and so I just want to pass some of that info along. If this seems like it might be up your alley or this is like your jam, please subscribe, like this video, do all that stuff that all those other kids say, because I guess that helps. And let's get started. So today what I wanted to do is talk a little bit about arthritis. It's a topic near and dear to my heart. I see it every day, all day, and now with a little age, I'm experiencing it. And the thing I wanted to talk about arthritis was how we have different types. You know, we all tend to think about arthritis as being a thing that like our grandparents deal with when they're, oh, my knee or my back. But really there's a lot of different types of arthritis, and we're not going to go over all of them because that's kind of, you know, that's what a rheumatology fellowship is. But I want to go over the two main types that people oftentimes get confused, and that's osteoarthritis and rheumatoid arthritis. Now, osteoarthritis is a degenerative type of arthritis, and we call it a wear and tear arthritis. This is the arthritis we're thinking of when we think about our grandparents. It happens as we get older, but it can also happen from trauma. So you want to think of like your football player or your professional athlete that's particularly hard on their joints. That can then lead to osteoarthritis. We tend to think of it as non-inflammatory. Now, the truth is, when more research comes out on osteoarthritis, we will most likely find it is a lot more complicated than we previously thought. And we'll most likely find that there is some inflammation going on in the joint. But for the time being, and for the sake of simplicity, we still refer to it as non-inflammatory. It is not a systemic condition. So what do I mean by that? I mean, it's a disease of the joint. Doesn't affect your heart, doesn't affect your lungs. It has a big impact on quality of life, but it doesn't seem to have an impact on the length of your life. So that's something. The other type of arthritis I want to talk about is rheumatoid arthritis. Now, osteoarthritis and rheumatoid arthritis get confused all the time, but they are not the same thing. Rheumatoid arthritis is an inflammatory, autoimmune, systemic arthritis, meaning inflammatory, it's inflamed, it causes inflammation, it leads to inflammation. Autoimmune, your immune system's attacking your own body. Systemic, it affects more than just the joints. It can affect the eyes, the lungs, the heart, your brain. I mean, it can affect everything. People will have fevers, they'll feel immense fatigue, they can get headaches. Yes, they have joint pain, but they can have a lot of other things too. It can happen as we get older, but it also happens in all age groups. Kids can get rheumatoid arthritis, teenagers and all the way up can get rheumatoid arthritis. It is in about 1% of the population, so it's not uncommon, but it's certainly not as common as osteoarthritis. It is a completely different beast. We do blood work, we do x-rays, you need to see the doctor on a regular basis. We have a slew of medications out now for it. So differentiating between the two is really important. Now, there are some things that you can kind of check into to try to figure out what side of the spectrum you're on. I know that there's a lot of information out there in Dr. Google telling you what kind of arthritis you have. I will say ultimately, it's always best to get a doctor to look at your joints and to hear what you've got to say. But some clues that might kind of get you thinking a certain way. First thing you want to think about is, where is your pain? Is it in your low back? Well, that's most likely osteoarthritis. Is it in your hands, your knees, your feet? Well, it could be either one. Is your pain on both sides, both hands, both knees, both feet, or is it only on one side? Those are things to keep in mind. When you have your pain, is it pain in the joint or pain and swelling? Pain and swelling can get the doctor thinking a different thing. Just pain tends to be mainly osteoarthritis. Other thing, in the morning when you wake up, do you feel stiff? Do you need to do some stretches in bed, maybe 2 to 3 minutes, and then you're ready to go? Well, that's most likely osteoarthritis. And I just described my own mornings. Or do you need a hobble to the bathtub to take a hot shower, and then before you know it, you've looked at the clock and an hour has gone by and you finally feel like you can start your day? Well, that tends to be more like inflammatory. So these are just clues. There is no one symptom that is definitive, but when you're writing your symptom diary in preparation for your doctor's appointment, these are things you want to think about. Also, is there anything else going on that is not joint related? Are you having headaches? Are you super tired? Are you feeling feverish? Are you having diarrhea? These are all things that the doctor needs to know. I know, it seems random. Why would I need to talk about my diarrhea whenever I'm going in for my joint pain? But you'd be surprised. Now, I'm biased. I happen to think that a rheumatologist should be the one to make a diagnosis. And ultimately, if you're having that much joint pain, you should see a specialist. There is no slam dunk diagnosis. On the rare occasion, I can tell someone has osteoarthritis from across the room. But most of the time, you need to have some other information. So when you go to see a rheumatologist, you will most likely leave with lab work and x-rays. Now, not all the time. Like I said, sometimes they're able to tell. But, you know, sometimes it can be confusing. And so we need that extra information. Now, I'm not going to go into all the nuance of all the different labs. That's for a different video. But just know there is no lab that is definitive, despite what Dr. Google says. I have made diagnosis of rheumatoid arthritis with people who have negative labs and vice versa. We need all this information in order to know what's going on. And the last point I was going to bring up is that you can have more than one type of arthritis. I know, it's so annoying, but it can happen. And it's important to know that it can happen, because only when you acknowledge that can you then begin to treat it appropriately. So let me give you 2 scenarios. One is a 7-year-old person has been dealing with some ongoing osteoarthritis for about 20 years, and then all of a sudden, bam, their hands just blow up. They're having pain they've never had before. Well, they might have developed rheumatoid arthritis on top of the osteoarthritis they already had. Another scenario, 50-year-old person has had rheumatoid arthritis for about 20 years, doing pretty good, having some flares every once in a while, but overall okay, and now having knee pain out of nowhere. Well, it must mean that their rheumatoid arthritis medicine isn't working anymore, right? Not necessarily. They might have developed osteoarthritis in that knee. Now, the way that we treat these are completely different. I'm not going to take someone off of their rheumatoid arthritis medicine just because they have knee pain if I don't know where that knee pain is coming from. Taking them off because they now have new osteoarthritis pain would only make their rheumatoid arthritis worse. The 70-year-old continuing to treat their hand pain with Tylenol as if it was OA would be doing them a disservice. That's not the way you treat RA. They need rheumatoid arthritis medicines. So understanding that these 2 things can live together is imperative in being able to find the right treatment. And so I'll leave you with that. Thanks so much for watching. Keep an eye on this space, more videos to come. Let me know if there's any topics in particular you'd like me to cover. I feel silly telling you to subscribe because I only have this one video up, but I'm gonna say it anyways because I need to get into the habit, I think, of saying it. So subscribe and like and hit that bell button, even though honestly, I've never hit the bell button on any of them because I don't need that many notifications. All right, thanks, bye-bye.